Thank you, Mr. Speaker. For women looking to start or grow their families, motherhood should be one of the greatest, most joyful time in their lives. But for far too many Black women in Ohio's 13th Congressional District and across the country, this experience is often overshadowed by trauma, heartache, and loss. It's no secret that Ohio, my home state, has one of the highest Black maternal death rates in the entire nation, with Black women 2 to 3 times more likely than white women to die from pregnancy or birth-related causes. And we rightfully talk about the social determinants of health that Black women face in accessing quality, affordable prenatal and postnatal health care in our communities, which contributes to these completely unacceptable maternal mortality rates. But today, I'd like to focus our attention to another contributing factor to Black maternal mortality that is often overlooked, and that is intimate partner violence. Homicide is the leading cause of death among pregnant women in the United States. It's higher than the 3 leading health causes of maternal mortality, those being hypertension, hemorrhaging, and sepsis. Addressing the violence that plagues women during pregnancy and shortly thereafter is why I introduced the Safer Homes and Families Act. This comprehensive legislative package would provide vital support to keep moms and families safe, including prohibiting the use of electronic devices for stalking, providing training for healthcare providers to better identify and treat individuals experiencing abuse, and allowing survivors to break a lease without adverse costs. Statistics have indicated that nearly 20% of women experience violence during their pregnancies, and in 1 in 6 women, abuse first begins during their pregnancy. This violence substantially increases the likelihood for pregnancy-related complications that not only endangers the life of the woman, but also that of her unborn baby. While members of the Congressional Black Maternal Health Caucus are working tirelessly to highlight and address the ongoing epidemic of Black maternal health, it is clear there is more work that needs to be done. Even to this day, we are still trying to convince colleagues on both sides of the aisle and in both chambers how important it is that we care for women and care for mothers. This is not a partisan issue. It is a human issue. Our Black mothers and babies in every district across the country deserve to live long, healthy, and happy lives. I'm confident that regardless of our political party, we can work together to improve health outcomes and deliver on the promise of better health, healthier lives, and brighter futures for all of us. So I call on my colleagues to join us in the fight to keep our moms and babies safe. Our mothers and babies simply cannot wait any longer. Finally, I'd like to recognize the many local organizations in Ohio's 13th Congressional District that are working each and every day to improve the health of Black moms and babies in our communities. Organizations like Stark County Thrive, Full Term First Birthday, Project Ujima, and the Minority Behavioral Health Group are all committed to improving maternal health outcomes and promoting equity in Ohio's 13th District. Improving maternal health requires action and collaboration at every level, and I am extremely proud and grateful for these organizations for the work that they are doing. This Black Maternal Health Week and beyond, I am committed to improving healthcare access to all and giving women and families the tools that they need to live healthy, happier lives in Ohio's 13th Congressional District and beyond. Thank you, Mr. Speaker. I yield back.